Well, I think that we need to have the understanding that research is very important because it helps us to have evidence to solve problems. It helps us to have evidence to answer questions. And in the health sector, there are health problems, so research will help us to provide that evidence. And we've seen that in several instances. I gave the examples of how we used research during COVID to be able to contain the pandemic, and globally, Nigeria did very well. People acknowledge that they were surprised that we were able to cope. So research is very important, but in order for us to be able to conduct useful research, we need to invest in research. And we also need to invest financially and also develop the human capital for research. Because it's one thing to have the money. If you don't have people with the know-how to conduct research, it won't be useful. So you must invest the human capital for research, and you must then invest in the research itself, in the conduct of research itself. And down the line, it pays off. So because research has returns on investment, and the returns on investment are huge. Well, readiness for pandemics will not be limited only to the Institute of Medical Research. Readiness for pandemic has to be a deliberate effort on the part of government, and it has to be multi-sectoral. It has preventive, we must have the ability to rapidly detect. We must have the ability to prevent, and we must have the ability to respond. And all those threefold abilities cut across not just the health sector. So it's a multi-sector approach that we will have to adopt. But there are some core sectors that will have to provide leadership. The health sector is one of them. And then, of course, now we don't talk about only human health. You also have to be looking at animal health, and you also have to be looking at the environment. And that leads us to the One Health concept, and it will, of course, require a multi-sectoral approach to address the issues.